Good afternoon. This is Dr. Norma Thomas, and this is the overview video for week 1 of Social Work 633, Social Work with Families. Week 1 is our introduction to family practice and to the communication model. And if you go into the course and down to modules, you can follow along with what we are to cover for this week. So first is our overview of what we are covering this week in the introduction. And so as we widen the lens to include the family system and socio-political context around an individual client, the potential solutions to that client's presenting problems expand as well. So in addition, as we consider the stage of development that the family is currently in, we can choose interventions that are more likely to be helpful. One of the earliest pioneers in this work is Virginia Satir, so her work is the focus for this week. The learning objectives are as follows: to provide examples of how some of the key concepts of general systems theory can be applied to family systems in particular, to describe the task associated with at least one of the 6 stages in a family life cycle, recognizing that not all families pass through each stage, to identify how the understanding of the family life cycle stages can assist a worker during assessment and goal setting with a client family, to describe how a social worker's own experiences in the family who raised them may impact their feelings on behaviors with client families, and lastly, to identify one of the useful takeaway points from the article that you choose to read, either by Goldberg or Carter and McGoldberg, and you'll see that in a second. So summary of learning activities, let's first go to the learning resources. And there are a number of readings that are required for this week. One is from the text, Working with Families of the Poor. And so you're looking at Chapter 2, the framework, a systems orientation, and a family-centered approach. The second is an article about what has become of Virginia Satir's therapy model since she left us in 1988. You can get all those articles through clicking on the links. The third is the article by Carter and McGoldrick, The Expanded Family Life Cycle. The next is Dysfunction in the Family of Origin of MSW and Other Graduate Students. This talks about the fact that many of the students coming to an MSW program have experienced some personal dysfunction in their family. And then Satir, Patterns of Communication, the New People Making. So that's your last required reading. There are several recommended ones. Carter and McGoldrick, The Expanded Family Life Cycle, is also a recommended one. Working with lesbian and gay parents and their children is another, and then Satir, Conjoint Family Therapy. Continuing with resources there, if you click on this link, this is a PDF that gives information on systems theory and family systems theory. This is a website, the Satir Institute of the Pacific, so it gives some specific information about the institute founded by Virginia Satir. And then the third is looking at a video. So to view the video, click on the link below, log into Widener's library website, and then view the video on working with a blended family. And this is an actual demonstration of work by Virginia Satir. You have 3 discussion posts for this week. So as always, please try not to get behind because it's really easy to get behind if you don't complete the work one week and try to postpone it to another. So if you're going to be behind again, let me know so we can keep track of your progress. So initial post, usually with all these posts, the initial post is due by Thursday and the follow-up is due between uh, Thursday and Sunday. So this one requires you to do a video so you can introduce yourself to your fellow classmates and myself. You're going to do this using Screencast-O-Matic. This video includes your name, your first year field placement and or most recent job title if you are not in field, what your experience has been in working with families, the basic structure of the family system or systems in which you were raised, so you can disclose as much or as little as you feel comfortable with doing. One role you have played in your family and how this role might impact your work with client systems, and then any questions that you have in terms of the course. Again, your response to at least one of your classmates is due between Friday and Sunday. Your post is due on Thursday. The next is to look at the shared case. This is a shared case that gets used across many of the courses. So in looking at that shared case, you're going to choose one of the concepts of family systems thinking listed on the Family Systems Theory Resource Guide that I pointed out, and provide an example of how that concept has been manifested in dealing with in Anita's family. Next, choose one of the 6 stages described in the Carter-McGoldrick chapter on the expanded family life cycle. And again, you can get that through this link. Describe a type of problem that a family may encounter completing the task of that stage and how a worker might help that family. And then give at least one example of a life cycle challenge faced by either a gay or lesbian family or a remarried family in either the Goldberg or Carter and the Goldberg chapter. So just to note, you will not see the responses of others until you have posted that initial post. One classmate you are to respond to, your initial post is due by Thursday, follow-ups after that due by Sunday. The third discussion post is looking at the satir video and then asking the following questions. How would you describe the communication style of various family members? How exactly did Virginia Satir use herself as a model of healthy communication? Because use of self is important in this model. What are 2 examples you saw of how she attempted to help family members to be healthier? The same as the other posts, you will not see the discussion of others until you have done your post. Again, initial post due by Thursday, follow-ups after that, finally due by Sunday. The next assignment is something you will be doing over a number of weeks, and that is the Family Therapy Theory Grid. And the grid, hopefully I can pull this up very quickly, looks like this. And let's move this so you can see it. It is a Word document. And so when you have enabled the document so you can edit, you can expand this document. As you can see, you don't get a lot of space. And so some students I know have decided to note week 1 below this grid or attach the grid. You are free to do all those things. The goal is to actually have something that you can compare between the theoretical approaches. So week 1 is communication. Week 2 is looking at structural. Week 3 is looking at Bowen family systems. Week 5, looking at some psychodynamic. And note that there are 2 blocks for week 5. So one is contextual, one is EFT, and the last is a narrative approach. So it's week 1, week 2, week 3, week 5, and week 6. You are looking at core concepts, interventions employed, cross-cultural considerations. And so for the first week with communication, be careful because sometimes people get confused since there are different approaches discussed during the first week. The focus on communication for this family therapy theory grid. Also make sure you note the citations where you're getting your information from in this grid. So make sure that all these elements are included. To talk a little bit about the Virginia Satir therapeutic approach around using communication, Satir talked about some places they say it's 4 categories, others talk about 5 categories of communication. Satir talked about those who are blamers, that a blamer behavior finds fault, never accepting their own role in a behavior, but it's always somebody else's fault, and they're more likely to initiate conflict. You have the placaters who are out to please, they are non-assertive, they don't agree, they don't disagree, they are trying to seek approval and therefore they avoid conflict, and their main concern is how others perceive them. Number 3 is the computer. This is behavior that is very correct and proper, but displays no emotion, masks feelings of vulnerability. They often appear cold or unfeeling, but may be masking fireworks underneath. So they often say things that are value judgments without indicating who could have made the judgment, which implies that everyone would agree. Another idea associated with communication theory is that of the distractor. And so distractors seek attention to compensate for their own feelings of loneliness or inadequacy. Rather than positive action, they use emotions from anger to guilt to avoid an issue or manipulate how others feel. Some talk about a 5th main idea or area of communication theory, but also it's an intervention, and that is to reach the level of the leveler, which is a more assertive communication style. Levelers have emotional balance and can relate to all kinds of people. The goal is mutual problem solving. They don't have threats to their self-esteem. They operate with congruency, which means what they say and their body language match. And this level of communication can be used to solve problems and conflict. One of the goals in communication theory is to get members of the family to be congruent and or to point out incongruent behavior. So incongruent behavior is when your mind thinks one thing, but your body does another, such as everything's wonderful, but you're crying, or smiling, but it's really a fake smile. So the feeling is that even though your body, you are saying one thing, your body is going to give away that that's not truly how you feel. So the goal in family therapy then is to help people get to their true selves, to be congruent. to be active listeners, so you really are listening to what people say, and you can question in terms of what people say when what they say does not match that body language. So active listening is very important. You'll see from some work with Satir, she uses touch a lot to work with families. We can You might touch on that when you're thinking about cross-cultural considerations or other considerations today, whether that would work or not. So, those are some of the key concepts. Those are some of the interventions, or at least the goals of working in terms of communication theory and with families using Virginia Satir's model. I look forward to reading your post and your family therapy theory grid this week. If you have any questions, please email me as quickly as you can. I'm pretty good at responding to email. At any time, if you want to have a phone conversation, please email me and we will arrange a time for that phone conversation. So with that, have a wonderful week, and I look forward to seeing your post this week. Thank you.